So, safe medication practices for home healthcare workers, preventing errors and protecting our patients. So, of course, I like to start with statistics. So, about 1 in 5 home health care patients experience a medication error at some point. Some of those factors that contribute to that is polypharmacy, cognitive impairment, and we're going to talk a little bit about that. Medication safety in the home healthcare is critically important. Our role is to be the safety net. Why medication safety matters. Medication errors cause 1.3 million ER visits per year, according to the CDC. 1 in 3 older adults takes about 5 or more daily prescriptions. Home health setting, or the home setting, equals fewer safeguards in the hospital because there's not all of those, those checks. In home health, there's no pharmacy to double check or hospital barcode to do scanning, which means that you will have more errors. They don't have that nurse or that pharmacy at home like to check every step of the way. Why are older adults at a higher risk for medication errors? Well, we mentioned some of those in the slide before, but older adults are at the greatest risk due to polypharmacy, which is they have more than 5 medications to take, which can make them very confused. They don't remember which medication is due or which medication they took, or if they took it at all. This could be age-related changes, like slower kidney and liver functions, what equals the medicine stays longer in the body. Memory problems, they may have skipped a dose, don't know if they took it or not, so they end up double dosing. Medication safety reduces hospital readmissions, ER visits, and overall healthcare costs. So the 5 rights of medication administration, which is right patient. You want to make sure that it's the right patient. You want to make sure it's the right medicine for that patient. Make sure it's the right dose. Double check those doses. Make sure it's the right route, which means if it's an injection, if it's oral by mouth, if it's a suppository, if it's an injection, things like that. If it's the right time, because some of those medications have to be taken at a certain time. Just always verify their date of birth, their name. Even if you know them, always verify their name. When you're looking at those doses, watch for the extra zeros, or if it actually says 5 milligrams versus 50 milligrams. The pharmacist also can make errors. I have had people on a few occasions that have had the wrong medication in their bag or another patient's medication in their bag. So we're going to go a little in depth about this. The right patient, use the 2 identifiers. Name, date of birth is always the most common. Like I said, even if you know them, make sure you confirm. Right medication, you're going to double check those labels. Look for those look-alike, the sound-alike meds. For example, clonidine and clonazepam. It may not sound alike to you now, but when they're giving you orders or when the patient is trying to pronounce them, those 2 are easily and always confused. For the dose, verify the strength again. A misspelled or misplaced decimal point can be deadly. 0.5 milligrams, or was it 5 milligrams, or was it 50 milligrams? The right route, oral, subcutaneous, which is an injection that will go in the fatty parts of the body. If it's topical, etc., like giving insulin IV instead of sub-Q can be life-threatening. Now, I don't know if some of you may have different roles. Some of you might be inside the homes. Some of the patients might have an IV pole at home. I know two patients that I worked with in the past I didn't manage the IV, but there was another nurse that came in to manage that. So those things are in the home. So just make sure if you do have those type of privileges, make sure you pay attention to those routes. Right time. Follow the ordered schedule. Some meds like antibiotics, seizure meds, insulin, they lose the effectiveness if not timed properly. Now this slide I included in there just to kind of give you an idea of some of the medications and the importance of reading those labels. Make sure that you verify the patient's information on the label when you get it from the pharmacy, or if the patient already has it at home in their medicine cabinet or their bag or whatever. Make sure you verify those medications. Look at the dose again, the prescriber, the date, because the elder population, they are known for holding on to expired medications. And these two at the top, hydralazine, hydroxyzine. Those two are not the same thing. And then the two at the bottom, this is an example of labels that look alike. The medication may not sound the same, but the labels look pretty much identical if you're not paying attention to what it actually says for what medication it is. Some of the most common high-risk medications you want to make sure you have extra caution with, like insulin, coagulants, opioids, which are pain medications, and cardiac meds. Now for the insulin, they can have risk of hypoglycemia. These medications are all listed as high alert medications. Over 50% of ER visits for older adults are from these categories: anticoagulants, diabetes, meds, and opioids. Insulin, they could be at a risk for hypoglycemia. Their sugar could be too low. Anticoagulants like warfarin or Coumadin has a bleeding risk. Opioids can overdose on those. It can cause respiratory depression. The cardiac meds, you have to watch those for toxicity levels. Opioids are risk of drowsiness, confusion, constipation, slow breathing. High doses can cause overdose, especially if combined with alcohol or sedatives. For the coagulants, I put a little note at the bottom. Teach families to watch for easy bruising, like nosebleeds, bloody urine or stool. Even small injuries can be dangerous bleeding. Know the difference between side effects versus adverse reactions. Like, is this common or is this dangerous? Like constipation with opioids. That's a side effect. That's something that we already know that's going to happen. But something like breathing slowed down, that's an adverse reaction, which means that you need to get them to the emergency room. So side effect is expected and is often mild. And another example would be some people get nauseous with antibiotics. Another one for the adverse reaction, these are unexpected and they're dangerous. So for instance, rash from like an allergy can equal like low heart rate, especially if they're taking beta blockers. That would mean that you need to get them to the doctor or to the emergency room right away. So just know the difference between side effects and adverse reaction. So this goes back to watching our patients closely. What to do if a patient refuses medications. So you want to stay calm and respectful. Arguing can make refusal worse. You can ask them why. Is it fear? Is it for side effects? You don't want the side effects. You don't understand the purpose. Can't afford the refill. And then you educate them. Use simple language. This medicine helps keep your heart strong, so you don't get weak or dizzy. And make sure you document clearly. Medication, the dose, time, patient stated reason. Yes, put the patient said because I don't want to. That's what you're going to document. Patient said because I don't want to. But also make sure that you have educated that patient if that's in your scope of practice or in your job description or your duties, if you're allowed to educate the patient. Report it to the nurse or the supervisor or whoever, whatever authority figure you may have. If refusal risk patient's health, like refusal insulin, seizure meds, heart meds, anything like that. Around 20% of patients refuse meds, often due to fear, confusion, or side effects. So we're going to go over a little scenario. Mr. Johnson, age 72, refuses his blood pressure pills. He says, I feel fine, and he doesn't need it. Now, this is very common also, and I'm sure if you are in this training, you probably can relate to, because we all do this. You have a prescription, especially antibiotics. You start feeling fine, and then once you feel fine, you're like, oh, I don't need it anymore. Okay, we all do that. But what do? You acknowledge it. Acknowledge the feelings. Educate on prevention. Your blood pressure meds keep you safe, even if you feel fine. You're going to document the refusal and report it to the nurse or the doctor. Now, good response would be, I understand, Mr. Johnson. Sometimes high blood pressure doesn't cause symptoms, but the medicine helps prevent strokes and heart problems. Now, wrong response would be, you have to take it, because that's too forceful. You can't make them take it. They do have a right to refuse it, and all you have to do is make sure you did your job, you did your part, and you documented that the patient refused it. Scenario number 2. Mrs. Lee, age 80, is on insulin. You find her shaking, sweating, and confused. Blood pressure is 52. What steps should you take? And the answer for this would be, recognize that the patient is having a low blood sugar, which is an adverse effect. They usually have a fast-acting insulin. Give them insulin or have them prepare their insulin. You can give them a glucose tab. They usually always have that. Like some juice, apple juice or peppermint or something. And then wait a little while and recheck their sugar. But you want to make sure that you're going to notify the provider, be it whoever you have to report to, the doctor, the nurse, or whomever. Now, here are some key takeaways. You want to always follow the 5 rights when you're giving medication, especially with those high-risk meds. Be extra cautious with high-risk meds, please. And those are your insulin, your digoxins, your Coumadin, your opioids, things like that. Document and report refusals or adverse effects. Caregivers are the last safety check before the patient swallows or receives the medication. When in doubt, don't give. Call to clarify. Remember, safe medication practices equals safer patients. And that is the end of our training. Until next time, you have a wonderful evening, wonderful day.